Masking and proper ventilation worked together to save lives during the pandemic. That's the latest from a newly released UC San Diego Health study. CBS 8's Kirsten Holmes took a look at the study and asks, would we be willing to do that again? Kirsten.
Yeah, researchers here at UCSD Medical Center say that not only did masking save their doctors, patients, and nurses, they say it could save them again if we get into these winter months and the COVID-19 pandemic numbers go up. RSV is running rampant, and we also are dealing with the flu. But the question we wanted to ask people, are you willing to wear that mask again?
We were preventing transmissions. Simple measures used in simple times along with good ventilation really makes a difference.
Dr. Francesca Torriani says UCSD collected more than 12,000 virus samples from more than 35,000 patients from November 2020 until February 2022. They found most COVID-19 virus transmissions happened outside of the healthcare setting. Dr. Torriani says they conducted a genetic analysis of the strains, contact tracing, and analyzed the data.
So not only a genetic relationship, but also was the person there at the right time to support that transmission.
According to their data, masks and proper ventilation was key because the study found that most COVID-19 transmissions occurred outside of the healthcare setting. UCSD research says most transmissions happened in break rooms and lobby areas.
That allows us to make decisions that are much more reasoned and less onerous on people. When we do say, it's time to mask up, please do so because it does protect.
But will you go back to wearing a mask?
Sometimes it was annoying, but I think I wouldn't mind it at all if we had to put our masks back on again. It's totally fine by me. And most of the time I feel safe, especially when I had a customer that came like really sick, like coughing in my face. So wearing a mask definitely make me feel secure.
No, man, I don't want to wear a mask. I just want to keep living. Just be as natural as possible, Just keep going.
Okay, so this study also says that even when hundreds of healthcare workers were getting infected every week during that Omicron surge and waves, healthcare workers were no more likely to transmit or catch the virus in a hospital setting than any other healthcare setting. They say that their masking and those ventilation guidelines actually worked. Reporting for CBS 8, I'm Kirsten Holmes. Back to you.
Kirsten, they're saying those tools worked. Are they saying that those are things we should be going back to right now? Is the situation bad enough we should all be wearing masks again, in their opinion?
They are not saying that we all need to go back to wearing the mask. They are saying it works, that better ventilation and wearing a mask will better protect you, but they're not saying let's all change all the laws and everybody go back to masks.
Kirsten Holmes reporting live for us. Thanks, Kirsten.